Hi everyone, welcome to our second day session on the head neck MCQs. I'm Dr. Ankit, welcome to our channel. And today we are again going to do the two MCQs in 5 minutes or less than that. So here's the first MCQ. A baseball player was hit in the base of the skull by the loose bat. He is hoarse and complains of difficulty swallowing. The X-ray indicates that the basal skull fracture that passes through the jugular foramen. Now, if the nerves passing through the jugular foramen were severed as a result of the fracture, which muscle would remain functional, right? So, first of all, you should know that what are the nerves that pass through the jugular foramen, and those nerves are our 9th, then 10th and the 11th cranial nerves. So, now they are asking which muscle would remain functional or which muscle is not supplied by these three cranial nerves. Let us look at the options now. Paretoglossus is a muscle of the soft palate and supplied by the pharyngeal plexus, in which the 10th cranial nerve is the one which is the motor. Sternomastoid is a muscle which is lying over here across the neck, and this and trapezius are supplied by the spinal root of accessory nerve, again supplied by the nerve 11, that is the jugular foramen. Styloglossus on the other hand is a muscle of the tongue, and except from this palatoglossus, all the muscles of the tongue are supplied by the 12th cranial nerve, and they pass through the hypoglossal canal. Lastly, fourth option, we have stylopharyngeus. Now this is the only muscle that is innervated by the 9th or the glossopharyngeal, and that again is passing through the jugular foramen. Therefore, the answer for this particular question is going to be our fourth option, is styloglossus muscle. Have a look at this, and in this we can look at the two foramens over here. That is the jugular foramen, this is the hypoglossal canal, and look at the contents. In the jugular we have 9th, 10th, 11th. In the hypoglossal canal we have a 12th nerve separate. Let's move to the second question. A 67-year-old man presents with the shingles on his left forehead. Now, shingles are your herpes zoster virus, dormant herpes viruses. In the left forehead, upper eyelid and the bridge of the nose as shown in this particular figure over here. What sensory ganglion is most likely affected in this patient? Now, we all should have a basic idea that we are dealing with the herpes zoster over here, right? Now, they lie in the dorsal root ganglia or the sensory ganglia. Now, they are asking you which sensory ganglia. So, what is the sensory nerve supply of the face? The sensory nerve supply of the face is the trigeminal nerve with all its three branches, V1, V2 and V3. Though this particular question, this particular area, the forehead and the upper eyelid, they are by the V1 or the ophthalmic division. The ganglia would remain the trigeminal ganglia, and if we have the option like this, here we have this option as the option number B over here, that is a trigeminal ganglia. While if you look at the other options, otic ganglia and the ciliary ganglia, both options A and D, they are parasympathetic ganglia. Well, on the other hand, the option number C, the superior cervical ganglia, is a sympathetic ganglia, right? Now, we should know the sensory nerve supply of the face, and here is a trigeminal sensory map. You can look over here that all these areas of the face are supplied by V1, V2 and V3 nerves. If you look carefully, then you will recognize that the forehead and the upper eyelid are under the territory of the V1, and the lower eyelid and the upper lip are under the territory of the V2. The lower lip and the lower jaw are under the territory of the V3. Also, do remember that this area around the parotid area or the angle of mandible, it is sensory innervated by the great auricular nerve, that is the ventral lemma C2, C3. Now, it's an important question, and we hope you are enjoying the sessions. That's all for today. All the best.